Could rubbing onion juice on your scalp actually help grow back your hair? Well, Dr. Berg says yes, and he even cites research to support it. If you've seen some of my videos, you'll know that I don't always agree with Dr. Berg's thoughts on hair loss treatment. So today, let's take a closer look at some of the science that he's referencing, and I'll share my take as a hair restoration surgeon.
For extreme hair growth, apply this twice a week. This natural remedy can work on many different types of hair loss problems, whether it's autoimmune, nutritional, or even an overgrowth of some type of fungus or pathogen. And you're going to be using the juice of an onion. I'm going to show you how to supercharge that recipe to take it to the next level. If you're skeptical, you should be, because there's so many things out there that really don't work.
I'm quite skeptical, so let's dig deeper here.
People want to know about, is my hair going to smell like an onion? Now, let's take your results to the next level. There's two things that you can try. The first one is going to be pretty cool, but the second one's going to be even cooler.
Wow.
It's simply just adding something to the onion juice. You're going to be adding 5 drops of rosemary oil. What is so special about rosemary oil? Well, in a randomized trial in 2015, they compared rosemary oil to one of the top medications for alopecia,
Minoxidil.
and they found rosemary by itself was as effective as this medication.
Not exactly. Listen to what I had to say about that rosemary minoxidil study when I analyzed it in the past. Rosemary oil comes from a medicinal plant that has been shown to enhance microcapillary perfusion. There has been one single blinded randomized controlled trial that compared rosemary oil to 2% minoxidil ointment, and the results were that they were equally as effective. Let's analyze this study together. This was a study that was published in 2015 in the journal Skin Med from Iran. The impact factor of this journal is 0.2. Keep that in mind, because the benchmark as far as like the most popular journal is Nature, and that has an impact factor of 43. SkinMed is 0.2. They excluded patients who had 5-alpha reductase inhibitors on board in the preceding 6 months. Patients were randomized to either getting rosemary oil, which were 50 patients who received that, or minoxidil 2% topical, and there were 50 patients who received that one. The patients applied 1 milliliter of a assigned solution twice a day to the scalp for 6 months. The primary outcome measures were microphotographic assessment, and they looked at hair counts, but they didn't exactly explain their technique for measuring hair counts. You can see in table 1 that there's a similar age between the two groups and a similar hair loss duration as well. The baseline hair count, however, was higher in the 2% minoxidil group, making it, in my opinion, harder to later show an improvement. So when you look at this graph, which is their primary result graph, you don't need to be a scientist, in my opinion, to see that not much has changed across the board in both groups. Take a look. Minoxidil 2% group, rosemary oil group. To me, when you look at the hair number or the hair count on the y-axis, and then the baseline month 3, month 6, the time scale on the x-axis, there really isn't much change. And if you look at those vertical lines that are coming off of the rectangular bars, those are the standard deviations, and that's a pretty big standard deviation per each group. So they concluded in this study that both groups experienced a significant increase in hair count at the month 6 endpoint compared with the baseline. And they said in the present study, the application of topical rosemary solution was as effective as minoxidil 2% in the treatment of androgenic alopecia. Now, I take some issue with that. First of all, the large standard deviation reflects a large amount of variation in the group that is being studied. So it looks like it's unlikely that there's a statistical significant difference looking at the main values, given the fact that there's such a large standard deviation. And the conclusion of as effective should really say equally ineffective, because neither group changed by much from the beginning of the study. This was one of the clinical outcome photos that they provided in the study. This was for the minoxidil group. Now, what is going on here? Can anyone tell? Very hard for me to tell. The zoom of this picture from A to B, from the before and after, is quite different. The way that the hair is styled, the lighting conditions, all of that is very different in this photo, making it very difficult to compare. But then the author said that minoxidil is as effective as rosemary oil, but they're not showing efficacy in their study. And this is misleading since we have many studies showing real minoxidil efficacy for hair growth. So it would have been better if they demonstrated those improved results with minoxidil, and then they showed that there was also an equal bump up in efficacy with rosemary oil. That would have been fine, but here the results were very flat across the board. The large standard deviation underscores the large variation in the hair counts. So as you can see, there isn't any definitive data in the literature about the effectiveness of rosemary oil for improving one's hair.
The onion juice by itself has been shown to be pretty effective. So in a study in the Journal of Dermatology, they split this group in half, and half of the group did onion juice on their hair, and the other half just did water. And just within 6 weeks, the group that used the onion juice had an 86.9% result. And when I talk about results, I'm talking about significant hair regrowth, compared to the other group, which just used water, only had a 13% result.
So I dug up this onion study that Dr. Berg references, and I've actually included a link in the description below if you want to look at the primary source article. But I think it's important to dive deep into how the study was performed and to really see what are the takeaways from the study, because it's not exactly how he's presenting it. So yes, there's one clinical study in the literature on using onion juice for hair loss. This was a 2002 study out of Baghdad, Iraq. The purpose of the study, they stated to be the following: to evaluate the effectiveness of topical crude onion juice in the treatment of patchy alopecia areata. Now remember, the most common type of hair loss in men and women is androgenetic alopecia. It's not alopecia areata. I have alopecia areata, as many of you know, but the 14 million or so viewers of Dr. Berg, most do not have that condition, I'm sure, and most will have some subtype of androgenetic alopecia, since that's far and away the most common type in men and women, and that nuance is extremely critical. So in this onion study, they started with 62 patients with patchy alopecia areata. This was a single-blinded, placebo-controlled clinical study. So it seems to me that the clinicians were maybe not aware of who received which treatment in evaluating the degree of improvement in the hair, but the patients knew what they were putting on their head, whether it was the onion juice or the tap water. The onion juice group started with 45 patients, and then there was the control group which just received tap water, and this group started with 17 patients. The treatment was applied twice daily, and the patients were followed for a total of 2 months. So importantly, 22 out of the 45 patients in the treatment arm defaulted from the study for unknown reasons. So that's like half of the people in the group didn't even complete the study. So in the onion group, full hair regrowth was seen at 8 weeks in 20 of the 22 patients assessed, for an 87% regrowth, which is what Dr. Berg was referencing. But again, this is for patches of hair loss, and remember that patchy alopecia areata hair loss oftentimes spontaneously resolves on its own anyway, whether you're applying onion juice or anything else or not. In the tap water group, 15 of the 17 patients completed the study, and the regrowth at 8 weeks was seen in only 2 patients, so 13%. So here are some of the issues, and there are many, with this onion study. The first is that this was overall a small study with a massive attrition in the treatment arm. Another is that the patients were not blinded to which treatment they received. And of course, we know that there's a real placebo effect bias that occurs in many studies that can have a very powerful impact on results. You may think you've done better because you've received the treatment, and the treatment, you're told, should be helpful for your hair. And you may ask, well, what's the problem with half of the patients in the treatment arm not completing the study? Like, who cares? How does that affect anything? Well, maybe they're the ones who saw no benefit. So you can imagine that the ones who were seeing some potential improvement stayed on the onion juice, and then the ones who saw no improvement said, the heck with this, I'm not putting this onion junk on my head, so I'm going to quit this study. And that, of course, will change the results, right? Because if all the people who didn't see much impact continued the study, then those percentages of improvement would have been driven down. Another major problem that I have with this study is, how did they even assess for hair regrowth? I don't see any definition of how they defined whether the hair regrew or didn't regrow. Did it just maybe partially come back? When they say fully come back, is that 80%? Is that 90%? Is that 100%? No one really defined like what full regrowth meant. There was no objective measurement in the study of hair density, hair caliber, hair count. None of that was included in the study. And again, the biggest problem that I have with this study is that it was for alopecia areata, which is nowhere close to the most common form of hair loss in men and women, which, as I said previously, is androgenetic alopecia. So citing a study that is not representative of most of the people who have hair loss is not that useful unless you're really speaking to a crowd of patients with alopecia areata, which I rewatched Dr. Berg's full video. He does not make it clear that his video is for areata patients specifically. Also, the average age of the patient in this study for both groups, treatment and control, is 20 years old. 20 years old is, again, not representative of most people with hair loss, especially not with androgenetic hair loss. So again, it's like, who is this study really for? It's not for the patients that I think are, mostly watching the video. And also in this study, the leading mechanism that they presented was not the sulfur and was not the, other, like sub-ingredients within onions. It was actually that the onion was essentially behaving as something that caused an irritation. So it was like an irritant contact dermatitis. So essentially, it was causing some degree of inflammation that we know for alopecia areata can help, because again, with alopecia areata, the autoimmunity comes from one's own T cells attacking the hair follicles. If we can guide those T cells to give them something else to do, like provide some irritant that then the T cells start to target, maybe then they leave the hair follicles alone and the hair starts to grow back. That's the concept behind squaric acid. And if you've watched my video on my own journey with alopecia areata, you would have seen that I used squaric acid in the early days to try to grow back my hair. But now imagine leaving this onion juice in your scalp for upwards of an hour, as Dr. Berg mentions.
Leave this mixture in your hair for about 30 minutes, but I would personally recommend to leave it in your hair for 1 hour.
So you can imagine, after leaving it for that long, how much potential irritation you can have on your scalp. Also, for this study, there's no real independent validation that was ever done. No one checked their results and confirmed that, they're reproducible. And this study is now almost 25 years old.
Now, there was another study on mice, a group that used the quercetin, and they actually did separate out just the quercetin from the onion, showed regeneration of the hair in all of the treated groups. And in the untreated groups, there was no regrowth of hair.
Okay, so quercetin, right? Something that's in onions that Dr. Berg is saying could also be what's helping to drive the hair growth. But let's talk more about that, and let's dive into that study just a little bit. Quercetin is a compound that's found in onions, and it is an antioxidant. And yes, there is some evidence that quercetin, not onion juice, can elicit hair growth in mice. But again, for alopecia areata, not androgenetic alopecia. So again, we'll include the link to this article in the description as well. But again, this is not for the most common type of hair loss. And the other thing is that the mice were actually being injected with preparations of quercetin. So high levels of quercetin being injected into them, right? Not applied topically. So it's not the same thing as, having some quercetin in onion juice. It's just not. And with the onion juice being applied topically to the scalp. Two very different things.
So now let's supercharge this recipe and take it to the next level. You're basically going to enhance the onion juice. Now, how do you do that? you're going to ferment it. You're going to take one onion, you're going to take the peel off, you're going to chop it up, you put it in the blender, strain out the pulp, and then take that slurry and put it into a mason jar. And then you're going to add a 8-ounce cup of water, and then you're going to take a teaspoon of sea salt. Then you're going to add half a teaspoon of raw honey. Mix it up really good. Put a cheesecloth over the mason jar or even a coffee filter. Then you're going to put it on your counter so it can ferment for 72 hours. And you're going to notice within the second day as these little tiny CO2 bubbles, carbon dioxide bubbles popping up. What you're doing is you're enhancing the quercetin. The nutrition that's in there is also going to be enhanced because the microbes are going to actually make more vitamins. So basically, we're taking this antidote to hair loss, onion juice.
Oh yeah, the antidote for all hair loss. No, again, they had one study for one subtype of hair loss, and that study was very weakly powered, and had major design flaws in the actual study. So to use that and apply it to, at a minimum, 14 million people that watch Dr. Berg, I think is at minimum problematic.
And we're magnifying it. And also the pH of the onion juice is going to be becoming more acidic to about 5.
All right, let's talk about fermentation here. Fermentation is essentially controlled spoilage. Fermenting onion juice in your kitchen to increase antioxidant profiles can be potentially dangerous. Unlike kimchi, kombucha, or sauerkraut, onion juice doesn't have the same protective environment. It's actually harder and riskier to ferment. That means that bacterial and fungal contaminants are real possibilities. You don't want E. coli, salmonella, Clostridium botulinum on your skin. That's not a good idea. Also, the new unknown chemical profile that fermenting onion brings and that hasn't actually been studied is a bit risky to just be applying onto your scalp. You have no idea what exactly is in there and whether or not that can do some harm. Having alcohols, enzymes, and toxic bacterial byproducts all over your scalp for hours on end, for weeks at a time, may not be the best idea.
Which is going to be very therapeutic to your scalp. Now, at this point, you want a cheesecloth, okay, so you can separate out the liquid and put it in that squeeze bottle and then apply it to your hair just like I have already talked about, which is getting your hair wet and then massaging it into your scalp for a few minutes and then coming out of the shower, waiting for 1 hour with the shower cap if you want. Then you're going to go back in the shower, rinse out your hair very thoroughly, and shampoo your hair twice. And I would recommend doing this twice a week for 6 weeks or even longer, depending on your situation. A couple other key things to note. There's so many different mechanisms involved with vitamin D in hair growth or loss of hair that you should be taking at least 10,000 or 20,000 IUs of vitamin D3 every day, or get a good amount of sun.
Yeah, most people get enough vitamin D in their diets, actually, to satisfy that requirement. Of course, some people don't, and sometimes we'll do a blood test to check that level to see if supplementation is needed. But that, again, is a very minor contributor to hair loss. And then as far as getting enough sun, well, if anything, the sun can also be something that is actually risky for the scalp when people aren't applying enough sunscreen, and if they have significant areas of thinning and they're under a lot of sun, that can actually do more harm than good to the scalp tissue.
And the only other thing you need to have attention on is to make sure you're eating the right foods to support the nutrients for your hair.
So again, in this video, he's kind of skipped over the essential things that we know actually have proven data to support not only maintaining your hair when the cause is androgenetic alopecia, which is what it usually is, but also for potentially stimulating your hair. So, we've covered those different modalities from finasteride to minoxidil to spironolactone to low-level laser light to PRP to microneedling at length on my channel. So if you want to learn more about the things that are tried and true, please feel free. And I'm not saying that all natural ingredients are useless when it comes to hair restoration. In fact, there are plant-based compounds that have strong clinical data to support them. And that's exactly why I developed the Feel Confident hair care line. I included specific ingredients under our unique root defense system. These include things like saw palmetto, pumpkin seed oil, curcumin, and caffeine. These aren't just trendy buzzwords. Multiple peer-reviewed studies show that these ingredients can actually help reduce DHT. They can also reduce inflammation, and they can improve the scalp environment to help support healthier hair. And unlike onion juice or rosemary oil that have weak and inconsistent data behind them, these root defense ingredients are backed by real science. And in this video that you can check out for yourself, I've gone through a lot of the different natural ingredients that have been tried and tested for hair loss and hair regrowth, and which ones actually pass the test of like, does this seem effective or not? So if you're looking for something that actually helps support your hair without making your bathroom smell like salad, check out our Feel Confident shampoo, conditioner, and thickening foam. They're now also available on Amazon.